Welcome to Healthy Living Revolution Live. My name is Deni Benedict. Healthy Living Revolution is a movement of people who are taking healthy back. We are offering this series to bring you some simple solutions and education. Our speaker for this episode is my dentist and my wonderful friend, Dr. Barbara McClatchie. Dr. McClatchie graduated from the Ohio State College of Dentistry. She continued to pursue education from the world-renowned Pankey Institute Advanced Postdoctorate Training. She is a Bale-Donine method preceptor, practicing the oral systemic connection since 2011. This practice focuses on preventative, personalized dental care. Her mission is to enrich the quality of life for every person that she meets. She is a founding member of the American Academy of Oral Systemic Health, which brings the medical and dental professionals together to be better advocates for their patients' health. Dr. McClatchie practices general dentistry with a focus on the oral systemic connection at Complete Health Dentistry of Columbus, Ohio. Her practice is located within the Heart Attack and Stroke Prevention Center of Central Ohio. She and her husband, Dr. Eric Goulder, board-certified cardiologist, joined together and opened the first of its kind in the U.S., where a dentist and a cardiologist have joined forces to practice prevention. Now it is my honor to turn this over to you, Dr. McClatchie.
It's such an honor to speak on a subject that I'm very passionate about, complete health dentistry. By the end of this presentation, I hope to empower you to take healthy back as it relates to your dental health and how a good lifestyle and whole food nutrition influences inflammation on your body. Good nutritional choices can actually save your life. Listen and I'll tell you how. Today I'm here with Lora Hooper, who is my registered dental hygienist. She was instrumental in bringing whole food nutrition of Juice Plus into my dental practice in 2015. Lora, I appreciate you joining me. You as the hygienist are the one actually treating the periodontal disease, so I'm very happy that you are joining me today.
Thank you for inviting me, Dr. McClatchie. It's an honor to be part of the Healthy Living Revolution series. Tonight, you are going to learn about the oral systemic movement and its correlation to whole food nutrition. I truly believe if you give the body what it needs, it can heal itself. As a clinician and researcher, I will show you simple ways you can transform your health from being stricken with inflammation to having an abundant health. So we have a national epidemic going on in our country that periodontal disease is the most prevalent chronic inflammatory disease. It's a startling statistic that more than 80% of Americans over the age of 35 have some form of gum disease. The biggest problem is that most Americans don't even know that they are harboring this silent inflammatory disease. As a hygienist, I am trained to identify, prevent, and treat this chronic infection. So here's just some startling statistics. Periodontal infections account for about 25% of stillbirths. When talking about dementia and Alzheimer's, there's significantly higher pathogens of oral bacteria in the brains of Alzheimer's patients. And when it comes to heart disease, our #1 killer, periodontal disease damages the blood vessels and dramatically increases the inflammatory response. So we have a new theory about chronic diseases, and that is that everything is centered around inflammation, around this chronic inflammation that is causing a cascade of inflammatory responses. Unfortunately, in our country, we're in a state of sick care versus health care. So I ask you, which will you choose? So let's take a look at periodontal disease. It is a microbial imbalance or dysbiosis in the mouth. You hear the same type of terminology when we're talking about gut health, that it's a dysbiosis. So that just means that we have bacteria that are in imbalance. So we're getting more bad bacteria than good bacteria. And when the entire bacterial colony is involved in creating this increase of oral inflammation, we then start to see the tissue and bone destruction, and it sets off a cascade of inflammation throughout the body. So periodontal disease is a chronic inflammatory disease.
The bacteria in the pocket enters the bloodstream through the bleeding gums and starts the inflammation process. What we have learned is that it's inflammation and its associated bacteria that drives the oral systemic connection. The oral systemic dental team is responsible to identify the type of these dangerous bacteria and then stop them from going systemic into our bodies. Here's another nice visual of the direct relationship of the bacteria from the periodontal pocket and the general bloodstream. What we now know is what happens in the mouth doesn't stay in your mouth. The mouth talks to the body, and the body talks to your mouth.
Dr. McClatchie, you're exactly right. What happens in the mouth definitely does not stay in the mouth. And we see the direct effects of these oral pathogens have on the blood vessel. They actually kind of thin out that lining and increase the inflammatory cascade, or increasing its permeability and allowing those plaques into that wall lining. And so a simple way for you to understand is that plaque in your mouth is plaque on the brain, which we talk about as Alzheimer's, as plaque on the heart or your carotids is what we talk about heart disease. So we know that periodontal disease is this inflammatory condition that puts individuals at a much higher risk for more serious systemic problems. And we take care of the mouth. Not only do we see that we get better oral health, but we also know that we'll get better general health. So here are these statistics to know and to be informed about. That when you have an unhealthy mouth, you're at 2 times the risk for a heart attack, 3 times for strokes, 4 times for dementia, 7 times for an unhealthy preterm low birth weight baby, and that can take 6 to 10 years off of your life. What's promising is that we can see by treating periodontal disease, or even prevention of that, is that we can actually reduce these types of risk. And so here's an article by Stroke that actually demonstrates how important it is that it shows that the treatment of periodontal infections reduce the risk for stroke.
The American Heart Association Journal cites the research in 2013 that there is a direct relationship of acute heart attacks and the oral pathogens, meaning the bacteria that are associated with the periodontal disease and root canal abscesses. Level A evidence research written by our mentors, Dr. Brad Bale and Amy Doneen, shows that there are 5 specific high-risk oral bacteria that are independently associated with arterial disease. These periodontal microbes enter the general circulation, causing a bacteremia. We now have objective testing available in dentistry to help us identify these harmful bacteria. 50% of heart attacks are triggered by oral pathogens. This is a staggering statistic, which explains why medical and dental colleagues need to work together to prevent heart attacks. Periodontal disease needs the focus of prevention. Periodontal pathogens have been confirmed as being present in the clot of the carotid artery. In fact, these high-risk oral bacteria that enter the bloodstream were in very high percentages when analyzed. This confirms our validity of testing and the aggressively treating of this bacteria so not to contribute to a cardiovascular event. This is the root cause tree. It helps patients understand all the factors that contribute to inflammation and the benefits of a dentist and a physician working together to treat these root causes to prevent a cardiovascular event. In this picture of inflammation, it's directly related to the atherosclerosis, or the plaque in the arterial wall. So if you look at the upper left, you're going to see that this is a nice, healthy artery. There's nothing in the arterial wall. And When we go over the next, we're going to start seeing some accumulation of soft plaque and cholesterol and lipids starting to form. This is not affecting the lumen or the area where the blood flows. As we continue to the right, we're going to see more plaque build up. We're going to start seeing the walls starting to bulge. And as we go to the next slide, you're going to see that there is a little bit of a break in the lining of the arterial wall. And so the body recognizes this as an invasion, and the body tries to heal itself, starting to form a small clot. If we go a little bit further along, as the soft plaque gets larger, the body starts to help heal itself and forms a larger clot. This clot can eventually break off and travel to either the heart or the brain. If it travels to the brain, it's called a stroke. If it travels to the heart, it's called a heart attack. We know that lifestyle and whole food nutrition plays a key role in how the body can defend itself from all of these inflammatory challenges. The dentist is responsible for 3 of the root causes that drive inflammation from the mouth. So we are responsible for identifying inflammation caused by periodontal disease, endodontic or root canal disease, as well as obstructive sleep apnea. We must form a new mindset. Periodontal disease is a medical condition with a dental solution. Periodontal disease is a chronic inflammatory disease. The American Academy of Oral Systemic Health has 12 facts that we can't ignore as it relates to the mouth-body connection. Now that you understand, once the bacteria from periodontal disease goes systemic, it becomes associated with other diseases. As we stated earlier, 80% of the adult population has some form of periodontal disease. 95% of Americans with diabetes has some form of periodontal disease. So research does support the direct relationship of periodontal disease with Alzheimer's, obstructive sleep apnea, diabetes, cardiovascular disease, cancers, as well as knee replacement and some pregnancy complications. Many of you may have already experienced your orthopedic surgeon asking you to obtain a dental clearance before your surgery. Doctors do understand that an unhealthy mouth could contribute to surgical complications. So before I grant a dental clearance, I require an objective saliva test to see how much your mouth is putting you at risk.
So the biggest drivers of inflammation from the mouth are what we screen for in the dental field are cavities. Those are infections in the teeth, and they're bacterial infections. Then we have periodontal disease, which is infection in the bone and the tissues. And this is also a bacterial infection. And then we have root canals, is where the decay gets so deep it gets into the tooth, or we form an abscess at the end of the root of the tooth. And these are infections in the tissue and bone and are also bacterial infections. So once we kind of understand this is all a bacterial infection, we can actually start treating good bacteria fighting off the bad bacteria.
Technology really helps dentists identify silent sources of infection and inflammation. These are images from a 3D cone beam X-ray. If you look to the image on the left, there's root tip abscesses at the root canal teeth, often filled with toxic anaerobe bacteria, meaning they're bacteria that live deep in the gum and tissue that don't require air to live. And it is these bacteria that trigger that unexpected cardiovascular event. These abscesses are often missed with traditional x-rays. As you look into the center area, this view shows the jaw, the sinus cavity, and all the teeth. We are often looking for polyps, cysts, and even chronic sinusitis in the sinuses, which are all sources of inflammation. But if we identify calcifications in the carotid artery in the scan, then we have just confirmed that this patient has cardiovascular disease and now is at an increased risk for an event if he has periodontal disease. The far right schematic shows a restricted airway, which may be indicative of obstructive sleep apnea. A diagnosis of moderate obstructive sleep apnea is equivalent to smoking 1 pack of cigarette a day on the cardiovascular system. It will take 10 to 15 years off of your life. So again, all of these items are sources of inflammation that we can help identify with advanced technology.
So typically, by time we see the first signs and symptoms of disease, so the inflammation, the bleeding gums, the pocketing that we talk about, the disease process has already been happening, and that inflammatory cascade is now in full form. And so we really want to catch this early because we know it's the host immune and the immune response that's actually triggering this chronic inflammatory condition. And what we do know is that diets and whole food nutrition gives you the best ability to fight this inflammatory challenge. So this study shows us the consumption of just at least 5 servings of fruits and vegetables a day may prevent the progression of periodontal disease. What we know about fruits and vegetables is that they are excellent sources of flavonoids, which have a direct effect on decreasing our inflammation in our bodies. And those flavonoids come from that whole food nutrition. So we're looking for those fruits and vegetables to bombard the body. In Harvard Medical School, it went so far to state that besides medicine, the guide reveals 10 powerful anti-inflammatory influences, such as eating fruits, vegetables, and nuts, minimizing stress, getting more sleep, and quitting smoking can help you take charge of chronic inflammation and prevent or reduce its damaging effects. So that's why Juice Plus just makes sense. It's a simple capsule form to get in and flood your bloodstream with 30 fruits, vegetables, berries, and grains. It's the power of plants. So people ask, how would I know if I have these oral pathogens? Well, in the dental field, there's a simple test that we can do, a saliva test. So we say, don't guess, just test and find out if you actually have these oral pathogens harboring in your mouth. And so with a simple saliva test, it takes 30 seconds, a swish and spit of saline. It's sent off to a lab, and in about 2 weeks, you get the lab test results back. And we can know if you have these top 11 bacteria that go to the body and can influence the inflammatory response systemically, but more importantly, how much that you have. And so it also lets us know from the lab the systemic correlations to those bacteria, as you can see on the right. So I say reducing inflammation can be pretty simple. Let's talk about great dental health care, brushing habits, get your regular checkups, and then eat the right nutrition, and you'll have a long, healthy life. So I want to share a little before and after of a couple patients. And so I set out to prove to myself not only that I could see it through the signs and symptoms, but I really wanted to use testing as a huge guide for the proof in the pudding. Is it really working? Not only in the bloodstream, but actually by the pathogens and the quantity and quality of those pathogens. So we know that people with better diets have better periodontal health, and here's the proof. Look at how much we've improved in the inflammation, we've reduced the bleeding, we've reduced the pocket depth, so you can see my ruler measuring, and more importantly, when you look on the right, we had a 72% reduction in this patient in the number of pathogens, and in the second patient, a 67% reduction. So not only could we see and measure the signs and symptoms, but we also had validation on our test, the reduction of those oral pathogens entering the body. So I'm very passionate about the oral systemic movement. That's one of my passions, to share and to educate the public, and then to help in the healing process. The reason that I am so passionate is that I want to share with you is that my oldest son, Alex, was stricken with a bone tumor at the age of 12. And so we have a family history of cancer, and luckily this tumor was benign. But my biological father died at the age of 56 from pancreatic cancer. And so I wanted to take our health very seriously and needed to do everything I could. He almost lost the outside of his bone, his fibula, when he went into surgery. And I was told that for every tumor that was found, there was a 10% increase in his cancer rate. So you can only imagine how important it was for me to find a way to help this child heal and to prevent further instances. And that night when I was at Children's Hospital, I came across a book that said, Help Your Child Heal. And it was written by Dr. Sears, here from our Juice Plus community. And inside it was a guide to help parents not only be advocates, but to give our children the Juice Plus capsules, flood their body with whole food nutrition, an easy, simple way to make shakes and get that in their system that was quick and simple and that they would love because they taste great. They also have the chewies in here, and just talked about great recipes are also stated on how you can help your child get the best nutrition and the best healing possible. What I loved about the Children's Health Study is that once I got my children on this, like Alex, to promote the healing, I started to see some of these statistics already. He was on less prescription drugs, and so what was started was that kids miss less school. They also are more aware of their health, and that was really important moving forward, is that our children can understand how important it is to take care of their bodies. One of the side effects was as I was helping my child heal, what I didn't realize is that I was also healing myself. And so here's a little bit of my before and after of both my husband and I, what happens when you just flood your body with 45 whole food, fruits and vegetables every single day. So I'm much more healthier and happier, I have a greater outlook, and I have more energy. And those are just some of the side effects of taking Juice Plus. So Juice Plus is a great way to bridge the gap. I say we all know what we should be eating, and so this is actually bridging that gap of what we know we eat and what a lot of us actually eat. So it's an easy way to get it into your body. So what I love about the capsules is not only that it bridges the gap, but we're flooding our body with these phytonutrients. And phytonutrients is what the body needs to heal and to prevent. It helps us on a cellular level in the bloodstream.
The research was so important to me, Lora. Juice Plus is the most researched nutritional product in the world. It gives me the confidence that I need to make the right recommendation for my patients.
And so how well are you taking care of you? Are you eating real food, not the processed food? We know that's what feeds the bad bacteria. So we want to get in whole food nutrition. We want to exercise. We want to get more hydration by drinking more water and getting our good sleep, 7 to 8 hours per night. And these are 4 great things to focus on to really start moving towards health. And that's what one simple change really does, is it's an easy way for you to get started. And as a healthcare provider in dentistry, I'm always focused on prevention. So we've been looking at stress management, we look at food and diet, what we've been talking about, we look at exercise, and we look at healthy sleep habits. So those are 4 cornerstones to really focus on reducing your inflammation throughout the body. And what I love about the omegas is that they've bypassed the fish and went straight to the source to bring a blend of 5 omegas from algae, berries, and seeds. And what we know is that anti-inflammatory food components, such as our omegas, protect the body against possible damage caused by inflammation. What we also know is that anti-inflammatory diets really focusing on plant power, and so those plant-based diets, we know that from the Mayo Clinic actually states that these diets are helpful and they're very great way to approach nutritionally, and that they're nutritionally sound. And I think that that's very important moving forward. What I love is all the studies, because everything is interconnected. Just like I said, I'm passionate about the mouth-body connection. That's that oral systemic movement. And so we know that it helps improve cardiovascular wellness. It's supporting the immune system, which is so important in our healing, because that's the inflammatory process really pulling down our immune response. So we want to boost that. We see the gum tissue and healthy dental studies. It reduces oxidative stress, it helps reduce inflammation, protects our DNA, which is so important, and ultimately healthier skin. There's also insulin resistance, which has everything to do with periodontal disease. We know that our diabetics, 95% of them have periodontal disease. And so we know the sugar feeds those bad bacteria. And so it's a vicious cycle. And so we really need to get in these healthy foods so that we're growing actually more good bacteria and really getting that microbiome back into balance. And so as a tester in the dental field, it is so important that these antioxidants are actually bioavailable, and we can see that in the bloodstream.
Juice Plus seems like a great solution to offer to our patients. It helps the patient support a healthy inflammatory response to their periodontal challenges. This is why the Juice Plus study on periodontal disease is so important. It shows that when we give our patients something systemically through the antioxidants, that it has a positive effect on the mouth. It's reducing the bleeding, reducing the pocket depths, and the bacterial plaque. We know that Juice Plus is helping the body heal. Lora, you know that after doing periodontal therapy and you use your periodontal probe, you are indeed seeing the decreased bleeding and the decreased pocket depth.
And Dr. McClatchie, I absolutely love this study because it has everything to do with the testing and research and showing how important it is for our mouth health. And so yes, seeing the reduced bleeding, less pockets, what I do and I measure on a daily basis, and less plaque accumulation is one of the most important foundations for reducing our inflammation throughout our body. And this Wisdom 2 study showed how it reduced post-operative inflammation. And what I want to say about the shakes and the bars is that it's just so easy to integrate into your daily lifestyle. We simply want to help give our bodies what it needs, whether it's from the capsules or the shakes, which are healthy, balanced, on-the-go nutrition. And what I love about the shakes is that they're so high in protein and fiber, and more importantly, they are loaded with prebiotics, and it's those prebiotics that actually feed our good bacteria. So it's one of the best things that you can do for your body, especially I love to do that in the morning to get a shake, get my body headed out for the perfect day to get started. There's also bars that are easy to replace, I say, or used, for snacks and throughout the day on the run. And of course, ultimately, that's to help us have better quality of our nutrition. So many of us are running around during the day, and then we get we're starving ourselves, we get the hangries, and these are great ways to prevent that feeling and to keep your body healthy throughout the day.
As a dentist that works closely with the medical community, we have a mission. On a good day, we save a smile, but on a great day, we save a life. As Maya Angelou says, do the best you can until you know better. Then when you know better, do better. Let food be thy medicine, and medicine be thy food. As a complete health dentist practicing the oral systemic connection, we truly are bringing medicine and dentistry together so that we can be better advocates for our patients' overall health. It's all about inflammation. Dr. Eric Goulder, board-certified cardiologist, will be speaking on preventative approach to cardiovascular disease. It will be titled, Heart Attacks Are Optional. I hope you will join him to understand more. Lora and I appreciate your time today and acknowledge you for learning more about the oral systemic connection. Hopefully you picked up one pearl that you can share personally or with somebody that you love that may just save your life. Thank you very much.
Thank you so much, Dr. McClatchie and Lora, for your very powerful and empowering message. We'd like to encourage you to get back to the person who invited you to watch this webinar to learn more. I thank all of you for joining us.